Okay, so let's take a look at the next subsection, the cultural formulation interview itself. Now, remember from as I talked about in the reading, the video about the overview of the readings of this section, remember those templates that are there, and let me just show you what I mean. Okay, these templates right here, right? You do not need to know those for your exam. Okay. They're not for you to memorize. Think of them as a resource, and you may want to hang on to them. I mean, obviously, you'll be hopefully you'll find utility in your DSM-5 TR beyond this course. So you're not spending money just on that. It'll be something useful to you beyond the course. But anyway, so you think of those templates themselves as a resource, but we're not going to have questions. So I just want to make sure you you knew that. I highlighted some things here about the definition of the cultural formulation interview and the course CFI. So those things can make handy multiple choice questions on the exam. So just know that. Again, you don't need to memorize it, just know where to find that and reference back to it. All right. Um, so I'll just share a few thoughts that you can see in the written part of the lecture. So I created a bullet point list from the text of what the CFI focuses on, which again I think you can read and I think you'll get all that just fine. Um, the one thing I added in this is that the process of doing infusing, and that's how I think of it, is infusing these CFI aspects into your own assessment. Um, Another byproduct of that, in my opinion and experience, is that you're also doing that, also helping to foster a sense or a conveyance of empathy and trust, maybe a conveyance of empathy and a elicitation of trust with the client. So that, in other words, one thing I try to convey to clients is I want to hear their story. I want to know what's going on with them from their perspective. And I want to know about them. I want to know who they are. And I will say, hey, if you want, you can tell me about yourself first, what you want me to know about you. If you're not sure where to start, or, you want me to, I can ask you questions about your health history and your social history, and we can work our way outward from there. If you just want to start with what you think is most important for me to know about you, we can start there. Or if you want to get right into what's happening, and we can work our way backwards. Try to feel out what the client's preference is on that. So, but anyway, in the course of doing that, I think that you also have the positive byproduct of helping to foster empathy and trust in that therapeutic relationship you're trying to build. Again, as a byproduct of infusing the CFI, right? So I use the word infusing because for me, and I think the templates are fine. They're great. I think they can be a good resource. But I really think of us as more from a practical standpoint and a practice. It's more about incorporating these CFI concepts into your interview, and rather than the idea of like, okay, well, here's we're going to talk about your demographics, then we'll talk about your clinical stuff, and then we'll talk about your cultural stuff. Like that can come. I would see that as coming off pretty robotic to a client and not organic and thus not genuine. So I think it's about infusing these things and creating that setting of, hey, where do you want to start? What do you want me to know about you? Um, so those kind of things. And then, like, hey, if you're not sure where to start, a lot of times clients come in and they're just like, hey, can you ask me some questions? I don't know where to start. Okay, we can do that too. So, and I can, you can say, well, I can start with questions around what's happening right now, what brings you here, or I can start with questions about your social and health history. And you tell me what your preference is, where to start. Okay, and sometimes clients are coming to you and they're overwhelmed, they're in crisis, and you may find that it's better to sort of just take your best guess and go with it versus putting those choices on the client. So you have to kind of feel that out. Um, you see the again, I won't belabor this because we've talked about it a couple times already. That um, a lot of the how much it can be highly variable how much time you're going to get with a client, and if you're going to be able to see a client multiple times, or you're going to see a client one time and potentially not ever see them again. Okay, like in an emergency room setting, for instance. But we've talked about that a good bit.